Dr. Rhonda Patrick, there's so much stuff out there online. People, this is better for longevity as far as exercise. This is better, this much time. I think what people are really looking for is a little bit more of a playbook. Like, what can I do? What are the levers that I can actually pull rather than just a little bit of all of this? So I wanted to ask you, what are the best forms of exercise and how can we utilize them, more importantly, when it comes down to longevity? After this video, get 20% off of any Bubs Naturals product. Now, particularly their Halo Creamer. So we're talking just a couple of simple ingredients, nothing hidden in it, no weird nastiness. We're talking MCT oil powder, we're talking grass-fed butter, and they have a vegan formula that doesn't have the grass-fed butter as well, and tapioca starch. So it's filling, it lights your brain up, and it's a good way to start the day, but the taste is unbelievable. There's a lot of creamers that are out there, but this one just has a light fluffiness to it that just tastes unreal. So 20% off whatever you want from Bubs Naturals using code Thomas20, but definitely check out their Halo Creamer. Now, the cool thing about Bubs Naturals is that 10% of the proceeds go to charity in the name of Glenn Doherty. Now, Glenn Doherty was a Navy SEAL who went by the call sign Bub, which is where the name Bubs Naturals comes from. So the charities are all about helping the families and the relatives, people that are associated with special operations. So when you're looking at the military, you're looking at families that maybe have had family members killed in action, you name it. And Bubs is there to support them. So that's one of the big reasons I stand behind them. What they're doing is amazing. As someone that personally works with special forces and special operations myself, it's very near and dear to me. So again, 20% off whatever you get through Bubs, and know that 10% of those proceeds are going to an awesome cause.
That's a really big question. So I've spent a lot of time thinking about that question. What type of exercise is the best to improve the quality of life, to extend lifespan, to basically reach your maximum genetic potential? And from everything I've come down to, it seems as though actually vigorous intensity exercise is, I think, one of the most important types of exercise for longevity. And when I say vigorous, I mean getting your heart rate to at least 80% your maximum heart rate. And what I've looked at to kind of come to that conclusion is a variety of different data, starting with VO2 max, or cardiorespiratory fitness. I mean, this is one of the best indicators that we have of longevity. VO2 max is the maximum amount of oxygen you can take in during, maximal exercise. And it's a biomarker for cardiorespiratory fitness. Sometimes I kind of use those terms interchangeably. But essentially, if you look at VO2 max, studies looking at VO2 max and individuals, in their various age groups and VO2 max, the biggest benefit for VO2 max improvements are people going from low normal to low to low normal. So they're low, and then they go to low normal. That's associated with about a 2.1 year increase in life expectancy. So just getting out of that low zone is like the best thing you can do, right? Going from low to high normal is almost a 3-year increase in life expectancy. Going from low to high is almost a 5-year increase in life expectancy. So, that's a big difference. And I think on average, it was like for every 1 unit change in VO2 max, it's associated with a 45-day increase in life expectancy. And then there was another huge study that came out, it was published in JAMA in 2018, that cardiorespiratory fitness was kind of part of the equation, but it was looking at, fitness. Cardiorespiratory fitness, again, was part of that equation. And the people with the most elite fitness, so they had like the highest VO2 max, they were the highest cardiorespiratory fit people. They had an 80% reduced all-cause mortality compared to people with the lowest fitness. And, so essentially, I think that study, if I remember correctly in the discussion, they said there was no upper limit to the life expectancy benefits of high VO2 max or high cardiorespiratory fitness within normal human potential ranges, of course, right? And so with respect to VO2 max, I mean, right there, you look and you go, okay, well, how do I improve my VO2 max? Because that's really where it's at, right? I mean, if I'm not an elite endurance athlete that's training 20 to 30 hours a week, if I'm just a committed exerciser, which I am, someone that's working out, about 5 days a week. How do I improve my VO2 max? How do I get to that, that status where I'm high VO2 max level? And looking at a lot of literature, really, it seems as though high intensity, vigorous exercise is one of the most important ways to get there. So there was a study, Marty Gabala, who I had on the podcast not too long ago, brought this to my attention. There was a huge study that was done looking at people that are engaging in moderate intensity exercise. This is more like the zone 2 type of training, where you're doing endurance, you're doing aerobic exercise, but you're able to like have a conversation somewhat. It's like you're breathy, but you can still have a conversation, right? And those individuals that were still meeting the standard guidelines, so they were doing like 2.5 hours a week of this type of aerobic exercise, were unable to improve their VO2 max. And this was 40% of those of the whole population. So 40% were what they called non-responders. So they were not getting VO2 max improvements from just 2.5 hours of a moderate intensity exercise every week. And I was like, wow, that's really surprising. You think that people doing 2.5 hours of aerobic exercise would be getting some improvements in VO2 max. Well, not everyone was, until they started doing vigorous intensity exercise. Then they were able to get VO2 max improvements. And, you can look at a variety of studies. There's lots and lots of evidence. I mean, yes, you can get VO2 max improvements when you're doing a lower or moderate intensity type of exercise, especially if you're clocking in a lot of hours, like elite athletes are, right? I mean, they're training, 20, 30 hours a week. And plus they're getting they do a lot of vigorous intensity exercise on top of that. But if you're just talking about the average sort of committed exerciser or even casual exerciser, which is even less, like 2 to 3 days a week they work out, then it's getting to the point where I think vigorous intensity exercise should be most of the workout. Most of the exercise time that you do should be doing that vigorous intensity exercise. And that's, the VO2 max is one aspect of it. But I think one of the studies that really sort of, I don't want to say changed my mind, but really motivated me and was very much a turning point in my mind. And this was a couple of years ago out of Ben Levine's group at UT Southwest. He took people that were 50 years old. They were healthy individuals. So these were 50-year-olds that didn't have hypertension or type 2 diabetes or any of that, but they were sedentary. So they weren't physically active. So they were quote unquote healthy, but essentially I would say they're more just not unhealthy, right? More than anything. They didn't have disease states that were at least measured by our standard biomarkers. And he said, okay, we're going to put you on a 2-year exercise program. And Ben really studies a lot of the heart structural changes. So as we age, our heart gets smaller and it gets stiffer. And so the question was, can we take these people, put them on an exercise program, and sort of reverse the aging of the heart? So the exercise program was a progressive program. So it starts out a little bit more moderate intensity, but not for long. They quickly progress to vigorous intensity exercise. So this is like, these people were getting close to like an 80% max heart rate, 75, 80% max heart rate. And they were exercising 5 days a week. I think it was like 20 to 30 minutes. It's the kind of exercise intensity that you can maintain at 20 to 30 minutes. So it's that intensity where you're close to like 80% max heart rate, right? When you start to get above 80% max heart rate, it's hard to maintain that for 20 to 30 minutes for most people. And so they were doing this 5 days a week for about 20 to 30 minutes. And then one of those days, they were doing the Norwegian 4x4 training protocol. So this is a type of high intensity interval training that you do. It's a longer interval. And by the way, longer intervals is what has been shown to be the most important for improving VO2 max. Probably likely because you're getting the best of both worlds. You're getting the intensity, which is, you're stressing your cardiovascular system and in such a way that it's forcing it to respond by becoming more efficient at delivering oxygen to your tissues, which is why you're probably getting VO2 max improvements. But you're also getting the duration aspect, but you're talking about a 4 to 5 minute interval, right? So you're getting kind of the best of both worlds, the intensity and the duration. And so it's 4 minutes of like as intense of an exercise workout you can do to maintain it at that intensity for 4 minutes. And then you have a 3-minute recovery where you're essentially going to like zone 1. I mean, you are recovering because you're about to do that again for another 4 minutes and you repeat it. It's a 4x4. So you're repeating it 4 times. And so they did this once a week. And after 2 years, these 50-year-olds reversed the structural part, like the aging part of their heart, by essentially 20 years. So their hearts look like 30-year-old hearts versus 50-year-old's heart.
How many times a week?
So they were 5 days a week they worked out for 2 years.
Jeez.
And this wasn't low, moderate intensity type of training. This wasn't zone 2. In fact, the control group, quote unquote, sham control, they did the same amount of exercise, but they were doing kind of stretching and body weight, sort of body resistance weight kind of training, kind of like yoga and stuff like that, which is, of course, very beneficial. Muscle mass is very important. However, they had they experienced none of those changes in their heart. Did they have metabolic changes that were beneficial? Probably. Was there muscle mass improvements and strength improvements? Probably. But we're talking about the heart here. We're talking about the heart, right? And so it was that vigorous exercise that was important for reversing the structural aging changes on the heart, the stiffness and the small, you're getting smaller, and all sorts of other, very technical terms that I don't really even quite understand myself, honestly. That was reversed after just 2 years of vigorous exercise in these 50-year-olds. That was like blew my mind, and that was like, okay, there's something to this here, right? With that all said, obviously, exercise is hugely beneficial. Any type of exercise, any type of aerobic cardiovascular exercise. And the habit is important, like being able to do it consistently. I think vigorous exercise is really the key here. And there's a lot of other reasons that I'd like to talk about. But I do want to caveat this with, look, if you just absolutely will never do intense exercise, but you'll go out and do a zone 2 run and you'll do that multiple times a week, then that's the exercise for you, right? I mean, like, with that said, any exercise is beneficial, right? In some way, you'll find metabolic changes, like that stuff. There's many different endpoints to look at for health, right? But I do think if you're really trying to optimize that perfect, like I want to do like the best thing I can do for my heart, for my brain, for mental health. I think for my lungs, I think that vigorous intensity exercise, I'm convinced, it's the key.
Yeah,
so
I'm with you, and you and I are both big fans of bike ergometers and going that route too. And coming from someone that was a runner for a very long time, and I still enjoy running. But as far as there's even evidence that like going on a bike and hitting these intervals is actually quite good for muscle mass as well. I mean, if anyone that's ever really hit it hard on a Peloton or on a bike, they know that. You look at any cyclist that's a sprinter and their quads, right? I mean, granted, they're probably doing supplemental training, but it's not like you're just turning into this like high intensity cardio person that's just going to waste away. There is certainly an element of muscle preservation, especially if your diet's in line. So I don't want people to think that, oh, if I go do this, I'm gonna waste away. And you also don't have to have the compression of running. I know sprinting is big in the interval and high intensity category. It's like you have this one school of thought that's like sprinting, high intensity. Okay, well, I guess I have to sprint. So you've got all these people that are in their 50s and they're trying to sprint and they're beating their bodies up. It's like, okay, there is a bike. there are other options here.
Yeah, and actually Marty Gabala, is the one that told me sprint interval training is like that includes doing cycling. Like you don't have to be out there running, a sprint either. But and I think that for me, obviously there's the resistance. You can definitely add resistance to the biking and get the muscle component. And that was actually a question I asked Brad Schoenfeld because he's big, into a lot of resistance training. And I was like, I do so much, biking and high intensity interval training. And I really, part of the way I get my heart rate up is by just cranking up that resistance. And I stand and I'm standing and I'm doing my intervals. And it's really like, I'm feeling like burning in my legs. I mean, it's burning, right? It's definitely like you're saying, it's not like a trade-off necessarily. But I do think when it comes to cardiovascular adaptations and the aging heart one, what really kind of blew my mind, where it was just like, that's incredible. where it's like you can take this 50-year-old and put them on a 2-year program of intense. I mean, it's like vigorous exercise. They're working, they're putting in the work. It's not easy. Then, they get these, 20-year reversal in the aging of their heart. It's in 2 years. It's just pretty astounding to see that data, right?
It's hugely astounding. And if you look at if you're doing this 4x4 type training, I would imagine you are getting a pretty serious burn in the quads, right? Like you're probably also getting that, right? Like even though you're winded here, you're probably, you're just exhausted. So I would imagine that there's also a play of, lactate coming in here too, which I have a question for you. That we talked about lactate in another topic, but there's people probably watching from different avenues. Do you think that lactate levels are a contributing factor to the improvements in cardiovascular disease risk and things like that?
So the lactate question is an interesting one because I sometimes measure my lactate after a intense workout, and it's funny because most of the time, when people are trying to stay in that zone 2 level, they're trying to keep their lactate low, and I'm the opposite. I'm trying to raise it as high as I can, right? So lactate is a lot of times thought about this metabolic waste molecule. When we're forcing our muscles to work really hard, our body is using glucose without the mitochondria, and it's metabolizing glucose, and then lactate's made as a byproduct. And it's like, this is waste product. Actually, it's not a waste product. It's actually getting reused by muscle, by mitochondria for energy because it's easily used as energy by mitochondria. But it's also getting released into circulation. And in circulation, it's getting transported to tissues like the heart. And it's used, again, as energy in the heart. It's transported to the brain. And this is my biggest interest because of the effects on the brain. Lactate's being consumed at high quantities by the brain. This has been shown in a variety of animal studies, in human studies, radio labeling that lactate does get consumed during exercise and by the brain. And it's essentially not only an energetically favorable type of fuel. So what I mean by that is like your neurons like to use it because it takes less energy to use that than it does glucose. But it's also a signaling molecule. It's a way for your muscles to communicate with your brain. Hey, I have a lot of stress being put on. We got to respond to this stress. It's a stressful situation, right? And so it's a direct form of your muscles to communicate with your brain because you got to be mentally like on top of your game if you're like working out really hard. Like your body has these systems in play, right? And so it increases things like norepinephrine. That's been shown as well. So lactate increases norepinephrine. And this actually fuels your brain activity during intense exercise. And it's funny because fMRI studies have shown this, and you really like the norepinephrine having the focus and the tension. You really like it's part of that I think program of your brain also is working harder when you're exercising hard, just like your muscles and your heart. And it's important. You need your brain to work hard too, right? And that lactate is what's essential for that. Lactate's doing it. The other thing lactate's doing is it's signaling to increase what's called brain-derived neurotrophic factor, BDNF. And that is happening in your vascular system. It's also increasing at the blood-brain barrier, and it's increasing in the brain. And what it does in the brain is it's very important for the growth of new neurons. So this happens in certain regions of the brain, like the hippocampus, which is involved in learning and memory. In fact, there's a study from, I think it was like Dean Ornish's group many years ago that showed like a couple of months of aerobic exercise increased the brain volume in the hippocampus region by X amount in like older individuals. And it was like, oh, wow, you can actually increase your brain volume after exercise, right? So BDNF plays a role in that. It also plays a role in learning, strengthening connections between neurons and memory. It plays a role in neuroplasticity. So this is the ability of your brain to change and adapt to a changing environment. So this is very important for not only just cognition, but also just, plays a role in depression as well. So people that are depressed have decreased neuroplasticity. So in other words, they have a problem. Their brains aren't able to adapt to changing environments as well. And that's part of what sort of instigates the depressive feelings when you can't adapt to your environment. It's like what do I do? I can't I don't know what to do. So it plays a role in depression as well. So increasing brain-derived neurotrophic factor improves cognition, staves off brain aging, plays an important role staving off neurodegenerative disease. In fact, there have been studies in animals done, exercise-induced BDNF. If you give an animal a drug that blocks that, they don't experience any of the cognition benefits from exercise.
Short-term and long-term?
I don't know how long-term the studies went out. I mean, that's a good question. Because then it's like you get, well, what about taking that drug long-term? What's that doing?
Yeah.
But certainly short-term. So like the cognition boost and stuff that happened immediately. Also neurogenesis and stuff isn't increasing as well. But the battery of cognitive tests they subject these animals to, they didn't have the improvements that they did when they had the exercise without the BDNF blocking drug.
Interesting.
Yeah.
Do you think that like some of the mental benefits that we have chalked up to being endorphins is actually just an acute response to lactate?
I do.
Yeah.
I do. I think that I think there's a lot of things that are changing with exercise. I mean, Mike Snyder's group showed something like 500 molecules in the blood are like changing. 500. So there's a lot of changes that are occurring. Lactate, I think, is one of it is very acute. So you can go from at baseline steady state levels, most people have about 1 millimolar of lactate. When you start to do your high intensity training, depending on how intense we're talking about, let's say you go anywhere between 7 to 20 millimolar, that'll go down pretty quick. After about 20 minutes, you're back to 1 millimolar. And that largely is because other organs are consuming it fast. So in the brain being one of the biggest ones that actually consumes the lactate, again, it's fueling brain activity. So when your brain is like working harder, lactate's fueling it. So right now, our brains are working hard. We're having a very intellectual discussion. So the question is like, if we had just made a bunch of lactate from exercise, would that be, fueling and helping? I think so. Because, the lactate is increasing norepinephrine. It's increasing serotonin. It's increasing brain-derived neurotrophic factor. But it's also just helping our brain, use energy more efficiently. So lactate gets transported across the blood-brain barrier through the same transporter. It's called MCT as beta-hydroxybutyrate, that ketone body that everyone talks about, which you know a lot about from being in ketosis. It gets into the brain and neurons use it for energy, much like they do beta-hydroxybutyrate. So it's converted into pyruvate and easily used as energy, very easy, much easier than actually having to convert glucose into energy. And so, in fact, most people don't realize this, but a lot of neurons mostly are using lactate as energy because astrocytes, our brain supporting cells, make lactate and they suck it up from the astrocytes. And then the neurons and use lactate as energy. So, making extra lactate, in addition to what we talked about, increasing brain-derived neurotrophic factor, increasing neurotransmitters, it also increases mitochondrial biogenesis. So this has been shown in animal studies. Lactate itself increases a protein called PGC1 alpha, which is one of the main regulators of mitochondrial biogenesis. Animal studies have found that exercise-induced lactate gets into the brain. That increases PGC1 alpha and mitochondrial biogenesis, specifically in neurons. I haven't seen any human studies. I don't know that we ever will. I mean, to do that would require tools that we don't have yet. But there's no reason why that mechanism wouldn't be conserved in humans. I think it is increasing mitochondrial biogenesis, probably also in neurons as well, lactate in humans, yet to be empirically shown in humans. But that's another important aspect because mitochondrial health is hugely important for, cognition, for staving off brain aging, we're talking specifically in the brain. And then lactate is also allowing glucose to be spared from neurons. In other words, neurons then don't have to consume glucose. They don't have to use you have to use a lot of energy to be able to use glucose as an energy source. So they're not having to work as hard, and that glucose is now allowed to be used for other things. And what's kind of, there's a term in the literature called glucose sparing, the glucose sparing effect. And specifically in neurons, what happens is glucose can then be used in other biochemical pathways. And one of the main ones is the pentose phosphate pathway to make precursors for glutathione, NADPH being the main one. And so, and this has been shown that lactate can allow glucose sparing, and this allows then increases in glutathione synthesis because you're then allowing glucose to not be used as energy. It can be used to make this other important antioxidant. It's the major antioxidant in the brain. My personal take is that the repeated doses of lactate that you're getting from high intensity exercise probably have cumulative effects with respect to glutathione synthesis, with respect to, obviously, there's the brain-derived neurotrophic factor effect, all that stuff, right? But also just, going to the traumatic brain injury model, which I think is a very interesting way to look at brain aging in real time. Because brain aging is this sort of insidious damage that happens over time. It accumulates, and you have inflammation, reactive oxygen species, dysfunctional mitochondria, autophagy going down, protein aggregates. You get the point, right? Like, this stuff is accumulating over decades, right? And it's part of the aging process. Traumatic brain injury is it's almost like Alzheimer's disease, in real time.
Yeah, it's accelerated.
In fact, TBIs increase the risk of Alzheimer's disease depending on how many times TBIs have occurred, anywhere from 2-fold to 15-fold. Whoa. They have the same effect of having the well-known genetic ApoE4 allele, or it's almost like having two of them. So traumatic brain injury, a lot of damage is happening. It's almost like the whole aging process, but instead of over 30 years, it's 24 hours, right? So there's been studies with looking at traumatic brain injury and lactate. So George Brooks, the father of the lactate shuttle, the one who was originally responsible for showing lactate gets shuttled from muscle into the brain, into the heart, and it's beneficial and acting as a signaling molecule. He's done a lot of work with, collaborating with UCLA and traumatic brain injury patients. So people that are coming with a gunshot wound to the head, for example, they're coming into the ER. Infusing patients with sodium lactate improves their TBI scores and their outcomes. They do better. And so why is that? Well, it's probably a lot of reasons, but glucose sparing could be one. The BDNF, mitochondrial biogenesis, speculation on that. All these are sort of the mechanisms are sort of speculation, but there's a lot of possibilities and possible biologically plausible reasons why sodium lactate is improving TBI outcomes compared to just saline, right? So I personally think the more vigorous the intensity of the exercise, you're getting that lactate, and it's having such beneficial effects in the brain that it's really important for staving off brain aging. I have a high risk for neurodegenerative diseases. They're in my family. And so I'm very focused on the brain. And when I'm doing exercise, it's very much I don't want to get Parkinson's. I don't want to get Alzheimer's disease. And this is where, I think exercise intensity shines, and why I'm so focused on trying to get my heart rate up to make my lactate higher. I don't always measure lactate after every workout. I have measured it quite a few times, but trying to get my lactate higher, it's important to me because I think that it's just so beneficial. And I think that there's cumulative effects of it as well.
Definitely. And I want to double click on the glucose sparing effect for a second, because I find this so fascinating. You might be the person to answer this question that I've wondered for a long time. Clearly a similar effect to BHB, beta hydroxybutyrate, as far as glucose sparing, right? I have often wondered, as someone that lived in kind of the keto sphere for a long time, if so much of the improvements in network stability and brain energetics on a ketogenic diet was less about the presence of the ketones and cells being able to use ketones as fuel, and was more about the glucose sparing effect, possibly improving brain energetics. And was there, in the anti-inflammatory effect, was the anti-inflammatory effect of ketones really just there to help mitigate potentially more glucose utilization, which would drive more ROS? It's totally speculative, but I've wondered, because there was never research on it. It's purely your opinion, because it seems like this is a parallel discussion here as far as lactate and with intense exercise, and perhaps ketone production in long duration exercise. It's you're getting to the same point, but via different mechanisms, right? Does that make sense?
Totally. It's a great parallel, actually, Thomas, because beta hydroxybutyrate, very much like lactate, in addition to glucose sparing, in addition to being a preferable, easily utilizable energy source in multiple tissues, including the brain, beta hydroxybutyrate is also a signaling molecule like lactate, and they both signal to many of the same proteins. So beta hydroxybutyrate increases brain-derived neurotrophic factor as well, like lactate does. There's a lot of overlap between the way these signaling molecules, they're both signaling molecules, and their downstream effects. I think there's a lot of parallels. And I do think there's an intensity duration trade-off. And when I say I think vigorous exercise is like one of the best things you can do for longevity, I should also specify here that, I mean, obviously an endurance, athlete that's training 20 hours a week, like they can't be doing vigorous exercise for those 20 hours. Like that's actually not good, right? Like that's too much. So really what I'm talking about is the majority of people that are not endurance athletes, that are just looking for the workouts that they can do to improve their longevity, to to give them, the best mental angle, so improve cognition and improve their profile and risk factor for neurodegenerative diseases. So I think that's also very important, because in some respect there is an intensity duration trade-off when you're getting to like those elite levels. I mean, obviously, like people that are doing a lot of zone 2 type of training that are athletes, I mean, they're getting beta hydroxybutyrate, which is a signaling molecule. Yeah. Now, I mean, so there's like, how much of that are you getting from a 1 hour run at zone 2? Not as much as you're getting from a 3 or 4 hour run. I mean, so it's hard. I think you have to be very careful to look at just the elite athlete and say, oh, that's what they have. But it's like, well, they have that because they're training 20 hours a week. Yeah. And they often do this 80%, moderate zone 2 intensity type of exercise, and then they do 20% high intensity, right? Yeah. Their 20% is what, like 4 hours a week of high, like that's more than just the committed exerciser's doing. So, the whole picture is really important as well. And like, should someone that's doing 3-4 hours a week of training do an 80-20 split? I don't personally think so. I think that someone not training, more than 10 hours a week probably should be doing at least 50% of vigorous exercise. And if not more, especially if they're getting more, if they're more of the casual, like I work out 2 to 3 days a week. There's a lot of evidence with respect to like mitochondrial benefits. So mitochondrial biogenesis, we talked about that in the brain. Lactate is a signaling molecule that increases mitochondrial biogenesis. It does it in other tissues. So PGC1 alpha is the main regulator of that. And, high intensity is a big signal. It's all about the stress that you're putting on your muscular system or your cardiovascular system or whatever it is we're talking about. Your body adapts, right? And so the adaptations are greater when you put more stress, right? So, I mean, there's a window of benefits, right? Like obviously if you're like doing a high intensity workout for like 3 hours, like you're getting outside of that window. Yeah. But what I'm saying here is that you can get a lot of mitochondrial benefits with a lower, I would say duration, but higher intensity, right? So you can get mitochondrial biogenesis from a lower intensity workout, but you have to do it longer, right? So that's again, intensity duration trade-off in some respects. But there's a lot of people out there that aren't going to go out and run, for 10 miles. They're not going to run for 5 miles. Might not even run for 3. Like, so what can they do that's going to be beneficial? And I would say getting their heart rate up to 80% max heart rate, mixing in some Norwegian 4x4. That's like my new thing that it's like the thing that I am now starting to do. Whereas I was mostly doing a lot of, I think my longest intervals were more like 1 minute intervals, but now I'm convinced I need to be I like to really get the VO2 max improvements, doing the longer interval, I would say 3 to 5 minutes, with the Norwegian 4x4 really catching my interest with that heart study. I'm like, this is what I'm doing. This is something I need to do. So,
do you think with the Norwegian training, this for my own curiosity, like does the same rule sort of apply as far as intervals, where like, is the actual time of rest super, super important, or is it more about whatever you need to get the adequate recovery to be able to have the adequate stimulus? Like with I've always said like 1-to-1 ratio intervals just kind of enrage me, because I'm just like, well, if you're really like pushing it hard for a minute you probably need more than a minute to recover to be able to really push it equally hard for a minute? Or is it all relative? Is it your rating of perceived exertion for that 1 minute and then your 1 minute recovery and then your rating of perceived exertion for that next minute recovery? Is it all RPE based or is it more absolute? And with like a Norwegian, like just your opinion on it, like if someone's like, okay, well, it's hard for me to go, X minutes hard and then with only X minute recovery, I'm just not there yet. I need a little more time. So do you think it's more important to keep the rest period as prescribed or the intensity period as prescribed?
It's funny. I kind of asked this question to Dr. Martin Cavallo because he's really the expert on high intensity interval training and all these things. And he was basically, it was my understanding, what he told me is that the recovery period is really important so that you can give it your all on the next interval, right? And like if you're really looking for, in particular, VO2 max improvements, where you're really trying to get that going as hard as you can for a longer period, the recovery is hugely important because you won't be able to do that 4 times. Yeah. Like you will be done after the first 4 minutes, right? I often will, I'll use my interval protocols that I do largely on Peloton, in varying ways. Sometimes I use them more like an interval where I'm like, I really try to go maximal and then recover and then maximal. Sometimes I use it more like I am doing a extended vigorous intensity workout where I want to be at like 80 to 85% max heart rate for 15 minutes. And I use it like that. So because of the way the protocols are, their intervals, like they don't have what I want. Yep. So I just kind of use the recoveries and I'm like, okay, I'm still going, so I don't go quite as hard, but I'm like still, I've got the resistance cranked up and I'm above zone 2, right? Like I'm above, like I'm not able to talk on my recoveries in some cases. So I think it really depends on what you're trying to do, right? So like, what's your goals for this training? Are you really wanting to do intervals where you're going all out and then recovering, or are you just kind of looking for a vigorous, longer sort of, workout?
Yeah, I guess a lot of it depends on your time too. Like, I mean, it's like some people really want to get that 1 minute quick, 7 rounds of 1 minute. And yeah. I guess kind of like even to your point about the endurance and the zone 2 piece too, it's like, there's no real solutions, only trade-offs, right? It's like, you can't, I think what you're talking about is applicable to the masses. That's what's nice, is because as someone that came from an endurance background, the amount of time, I mean, there's kind of a joke in like the triathlon community of like being basically widowmakers, right? Because you're never home, like you're just training, right? And I think people sometimes forget that to really get that, and this is not to bag on zone 2, like as you and I are both in agreement on zone 2, but like to get the volume and the duration that you need, like when are you home? Like when are you really home? And that's what I like about kind of your approach with this, is it's very similar to mine, because I mold this a little bit with resistance training too. I'm a pretty low volume resistance training guy. And people think that like, just based on how I look, that I spend hours in the gym. Like, no, minimum effective dose here. Like it's the same, like, how do I use tools? How do I put my muscles under load and I think, and this is actually a good question for you too, but I know you've got some really specific protocols and I want to give you a chance to talk about those a little bit. But with the muscle side and also in relationship to even the VO2 max side and all of that, there's sort of these 2 different pieces. There's almost like the metabolic side, which is all the signaling molecules and like what's happening there. And then there's the sort of like mechanical side, right? So I can say from my own perspective, like with resistance training, and I don't want to pivot too much in resistance training, but I have focused more on the metabolic side. I couldn't care less about like the muscle trauma and the load. The only reason the load matters to me is how much metabolic sort of stimulus am I getting? How much of that lactate? How much am I actually like, I'm focused on the signaling device piece, right? Like, I don't know if that makes sense at all, but like there's people in the resistance training world that will think about, well, it's the trauma effect. It's the, breaking down the muscle fibers. Maybe that has a play, but as far as time is concerned, just to parallel what you're talking about, it's more about what is the maximum amount of sort of metabolic load I can put on my muscles. Does that make sense at all?
Mm-hmm. Yeah.
Yeah. So it's like with that, I mean, what is sort of your protocol as far as maybe how do you implement a little bit of resistance training in here too? Because I'm sure people are wondering that. You do a lot of this kind of training. Clearly you do some resistance training too. Like how do you meld that in?
And that's probably one of the biggest, I would say, my biggest drawbacks is the resistance training over the years. And I've recently, in the past year, really focused a lot more on that. I actually do a lot of dumbbell for my resistance training, with the exception of my legs, which I do a lot of Peloton, or I'll do lunges and Peloton, high resistance Pelotoning, where, like I said, I'm getting my quads and stuff. I do a lot of lower, I would say, it's like I'm fatiguing my muscles, but it's not necessarily, I'm not super good, going super hard, heavy. Mm-hmm. I'm going hard, but not super heavy. Right. And so it's like, I'll do my dumbbell and I'll turn on a Peloton programming thing. And it's like doing a lot of paired sets and drop sets where I'm just totally fatigued and there's no stopping and I'm switching and I'm just done after, but I don't need to, lift that heavy. Now, it doesn't mean I shouldn't ever. Maybe I think I need to incorporate more, but I think I need the right equipment. Like I don't have a bench right now. And I feel like I've already sort of somewhat injured myself by not doing a lot of shoulder ones without doing heavier ones without having the bench. And so I do a lot of dumbbell training, honestly, for my resistance training. And sometimes I'll just in the middle of the day, I'll just tell my husband, I'm like, hey, let's go lift weights. And honestly, we'll just quickly do a 10, 15 minute workout. That's just fatigue. And then I'm like, okay, that's my break.
Yeah. No, totally. It's funny because that's resistance training has almost become supplemental in my mind, because I think people have this thought process that you need a lot of it. You really don't. Genetics play a role, all these different things, diet, all these things. But I've started, and granted, full disclaimer, yes, I have clay mass on me already. So to maintain, I think you require 25% the volume as you do to build. So I'm aware of that. But I started treating resistance training as a supplement to my foundational cardiovascular training, whereas it used to be the opposite. I used to think resistance training and then supplemental cardio. And it's now, because resistance training doesn't get me the heart rate effect that I want to feel like I'm getting an adequate metabolic workout. The only way, I'm just like you, I don't lift that heavy. I do a lot of drop sets and I just keep the burn going because I try to, not that I want to make it cardiovascular, but I want to feel a benefit on my muscles metabolically. I want that lactate burn. Or that hydrogen burn, right? I want that response. And I think you said it without really knowing it, but that is key. Resistance training, although periodization is important, it's if your foundation is just resistance training, I think you're leaving a lot on the table, because you can hit your cardiovascular goals and then have the baseline to be able to go do your resistance training with adequate rest in between and have it be fun and have it be enjoyable. And we talked about this even with zone 2 stuff, right? If you do zone 2 all the time, that's great. But if you do your vigorous exercise, then it makes it so that zone 2 can be your enjoyable time. It can be the time when you go out for a ruck or go out for a slow jog, and you can use it for enjoyment.
Have a conversation with a friend or, a significant other. Yeah, for sure. I do try to focus a lot of my training on high intensity and for the brain benefits, for the VO2 max, which I haven't actually directly measured. But there is a lab here in San Diego that I'm planning on going to. So that, hopefully I'll be able to then use my Norwegian 4x4 to improve that as well. But, the brain-derived neurotrophic factor is also something I'm just super interested in optimizing for, particularly because of the brain effects, the neurodegenerative disease, and cognition effects as well, right? Yeah. So I want to be able to improve that. And I mentioned that I have a BDNF training protocols, a free guide that I've generated where it's a lot of evidence-based, what kind of exercise, what time and duration, intensity has been shown to increase BDNF in people, has been shown to improve cognition, not only exercise, but also other lifestyle factors. So hot baths, hot tubs, saunas have been shown to increase brain-derived neurotrophic factor. Again, what heat or what temperature, what duration, those types of protocols are in this free BDNF guide that I created, as well as other things like omega-3 increases BDNF. So what dose does that? Polyphenols from things like cocoa as well. And these are also, I have in that guide, just like things that I also do, my protocols as well. But it's a free guide, and I think it's, it's a kind of a useful tool because they're just evidence-based, protocols that can be done that have been shown to increase brain-derived neurotrophic factor, which at the end of the day, I think is a very, very important, biomarker for brain health, for longevity. In general, I just think it's good for mostly cognition and brain health.
Yeah, no, and we'll link out to that. And it's just bdnfprotocols.com, right? Mm-hmm. Yeah, so super easy. And we'll link out to it just in probably the second line of the description. So, and that's a totally free guide too.
Totally free. Yeah.
That's cool. I mean, it's with BDNF, you may or may not know the answer to this, but can someone get more efficient at producing it? So is it, if you took someone off the street that had never worked out before, again, there may not be an answer to this, and put them through a workout that would elicit X amount of BDNF, and then you trained them for a while, would they get more efficient at producing it? Is it an adaptation where the body says, okay, yeah, hell yeah, bring it on, and starts producing more? Or is it something where it's more like, whoa, this is a crazy trauma shock to the body. We produce a bunch in the beginning and then we get less efficient or producing less?
I don't know that that's ever really been directly measured that I've seen. There is a lot of genetic variation in producing BDNF, in producing lactate, and the lactate is part of, what regulates increasing BDNF. So there's going to be individual variation there just from genetics. But in terms of training, it's an interesting question because, some of the BDNF also is part of the stress response, right? So when you're stressing your body, you're making more BDNF. It's interesting because there is somewhat, if you look in the literature, it's definitely an intensity duration component to BDNF production. So the more intense the workout and the longer, the better the BDNF production. But when you have both, it's the best. So 30 minutes at 80% max heart rate was the best versus 20 minutes at 80% max heart rate, or 30 minutes at, lower intensity, 65% max heart rate, I think it was. So the best of all the best was duration and intensity. Again, going back to that, getting the best of both worlds, right? But it seems as though it's the area under the curve that's important. So in other words, it's somewhat of it doesn't go super, super, super high, but it kind of lasts a little bit, if that makes sense,
totally.
Which is, interesting as well, because it's not the lactate. I mean, it's immediately gone. It's your body, your brain's sucking it up, your heart's sucking it up, your muscles sucking it up, right? It's going away. But the BDNF kind of hangs around just a little bit longer. I mean, it's still transient, but it is a little bit more of it. Instead of just being a boom, you release a lot of it. It's kind of you release it and then it kind of stays around. And again, that's where intensity and duration together are the best.
Yeah.
So
could you stack benefits to sort of extend that? So vigorous exercise, and then be okay, well, that pathway, that means of producing it is done. Let's go sit in a sauna for
exactly.
Okay.
Yeah. So I've never seen that studied in humans directly, but animal studies have shown that that exercise plus sauna is better at increasing BDNF than exercise alone. So it does seem to have an additive effect, at least in animal studies. Now, also the same goes for cardiorespiratory fitness. So human studies have found that endurance exercise, aerobic exercise, I should say, not endurance, aerobic exercise is associated with improved VO2 max compared to not exercising, right? obviously. But if you add sauna on top of that, the VO2 max improvements are even better. And that's in both observational studies as well as a interventional trial that was done by Jari Laukkanen out of Eastern Finland. He took people and he put them on an exercise protocol or a exercise plus sauna protocol, and then measured changes in their cardiorespiratory fitness, so VO2 max. And exercise did improve VO2 max, but exercise plus sauna improved it even more. So there seems to be additive effects with heat stress, deliberate heat exposure, and exercise with respect to brain-derived neurotrophic factor, at least if we're looking at animal studies, and then VO2 max if we're looking at humans.
Interesting.
So another reason why, and I get this question a lot. Well, I'm physically active. I train this and this and this. Do I need to do sauna on top of that? And it's well, you really like the most important thing you're doing, like exercise. There's nothing better, nothing, so that's done. But like, do you want to go a step above that? Because if you do, adding in a hot tub, and I say hot tub because now there's increasing evidence that, hot tubs is also doing a lot of the same things that sauna is. It's just a different modality of heating up your body, right? That you're going to get improvements as well, additive improvements in VO2 max. I also think in brain-derived neurotrophic factor. I don't see why that wouldn't be conserved in humans.
Yeah.
No one's really directly studied it yet.
Yeah. And I mean, and we don't want to like necessarily encourage people to do things that are intense, but have you seen any rodent model research on like concurrent training? Like people that I know a couple of people that literally bring dumbbells into, or even like Laird Hamilton will bring his assault bike into the sauna. That could be pretty extreme, but is there any evidence that like training under these high heat environments can have additionally beneficial effect?
I think that most of the evidence comes with just doing the two in general. Yeah. I will say that like training in heat in general, like there's been studies where it's like you have runners and they're going and running in like outside in like New Mexico in the summer or somewhere where it's like Texas, like hot, and so the training in the heat does sort of cause physiological adaptations that makes you better at just training in general. So you're sweating at a lower core body temperature. You're making heat shock proteins quicker. Heat shock proteins are a part of the adaptation to exposure to heat, which can be done either from ambient elevations in temperature, such as a sauna, or physically training, right? Getting active, you're increasing your core body temperature. So there is evidence that training in the heat, not necessarily going in a sauna and doing that, but like, training in heat does make you better, does increase the physiological adaptations to heat in general, which can be beneficial. I will say that, there's been a study that like the sauna in general, like it can take it out of you. Like you go in there, you sit in 180 degree Fahrenheit for just 20 minutes and it's intense, right? So it can affect performance, right? And so then if your performance isn't as good, then maybe you're not getting as many gains. So let's say you're strength training or something, like you're not doing as many reps or whatever, right? So in that regard, you have to be sort of careful that like maybe you're not getting the same adaptations that you would otherwise if your performance was better, right? But generally speaking, I personally do like to go into the sauna after exercise. And then there was another study that showed doing a sauna after resistance training, this is a very new study, very small study, needs to be repeated, but it did seem to increase the hypertrophic response. In other words, it was like having a beneficial effect on hypertrophy, biomarkers of it. And this was in people. I, for a long time, have been talking about how, sauna use, I think, sauna use is important for, or deliberate heat exposure from the sauna, or even just local, heat exposure is important for, I think, disuse atrophy. So it has been shown to cut disuse atrophy down by like 40%. And a lot of this, I think, has been shown to be linked to heat shock proteins, particularly in animal studies. I was one of the first ones out there talking about this in animal studies, and a lot of people gave me a lot of pushback on it. And then human studies came out. Turns out it was conserved. It was right. And so, there's now, I think, a lot of like even Stu Phillips, like, he's now becoming more convinced that, heat exposure is definitely augmenting, muscle protein synthesis pathways. It's playing a role in muscle mass. How that is exactly happening, we don't quite know, but it's definitely not something that I would say is bad for your gains, right? And certainly I think it's even beneficial, especially for periods of inactivity. Again, going to like older people that are not lifting weights. They're not doing any resistance training. They're absolutely battling sarcopenia. Like getting in a hot tub or a sauna might be really beneficial in regards to like preventing so much muscle loss. So I think there's like a huge, component to that being beneficial. I like to get in the sauna after my workouts. I sometimes like to just do it at night as well. There's like various
I'm the same
protocols.
way. Like, I mean, with post-workout, there's the theoretical benefit of, additional growth hormone. But I mean, I think you and I mean, it's probably more to do with, I think the benefit from a growth hormone perspective probably comes more from the sauna improving sort of that intracranial pressure and the lymphatic system, and you potentially getting better sleep and then ultimately getting a better pulse, right? That's probably my conclusion with it. But I found the same thing, like saunaing pre-workout doesn't seem to, if anything, it actually kind of drains me a little bit. It actually takes it out of me. It's like I feel like a stretched rubber band that's just like not contracting and not. Whereas post, I feel like it's also a good wind down. But I struggle with something that you mentioned, where like a sauna can be very draining, and sometimes you don't realize it, especially if you're an athlete and you associate being drained with like movement, and you're like, well, I'm just sitting here, but it's doing something, obviously. What's your sort of way of modulating that? Because I will do that. I will have a tendency, like I've rigged my sauna to get up to, 210 or 220 and like it gets hot. And I will like sit there and like sometimes torment myself going to like 30 minutes, 40 minutes. And then I'll get out. I'll be like, I think I just overdid it. And then I get sick, like I totally taxed myself. Do you have sort of a system in place where you recognize, okay, my heart rate's getting too high, or have you just gotten really good at listening to your body? Because I'm sure it's not always 15 minutes or 20 minutes. Like sometimes it's 12, sometimes it's 30.
I've gotten really good at listening to my body for sure. I think that a lot of people think there's this mentality like, you go hard, go home.
Yeah.
And in some respects, yeah, go hard, go home. Okay, I get it. But it's not always the case, right? Like you don't want to like take 100,000 IUs of vitamin D every day.
Yeah.
Like there's extremes, right? Like you don't, like you can go overboard. I think that people have done a little bit of this with the sauna, like where it's like you don't have to go to 220.
Yeah.
Like you probably shouldn't, in my opinion. I don't think that's
I started sitting on the floor now.
You're heating your brain up too. Like you don't, like that's really hot. Like all these studies that have shown benefits, the observational data coming out, like 50% lower risk of dying from sudden cardiac death, right? Yeah. All that stuff. These people are in Finland, they're using 175 degree Fahrenheit sauna with like 20% humidity. Mm-hmm. They're not going to 220, And so I don't know that you necessarily need to or should. That might be a little too much.
Yeah, no, I think it is. And I think that like, as far as my barrel sauna is concerned, it's obviously cooler on the bottom. So like now I've started being like, okay, let me listen to my body a little bit more. Go high heat for a minute, and then, okay, maybe I'll go sit on the floor where it's probably 175, 180, and kind of listen to my body a little bit more. Because for a while there, it was like, okay, like, yeah, as hot as I can go, let's just get all the way.
So there was a study. I don't talk about this a lot because I don't like confusing people. Mm-hmm. So the studies that have come out of Jari Laukkanen's group in Eastern Finland have looked at sauna use and Alzheimer's disease risk and dementia risk, and I've talked about this a lot. It's a very much a dose-dependent effect. So, people that use the sauna 2 to 3 times a week have 20% lower risk of dementia, something like that, and Alzheimer's disease. When they go up to 4 to 7 times a week, it's like greater than 60% lower risk of Alzheimer's disease and dementia. Now, I think a lot of that's probably related to cardiovascular health, right? Increased blood flow, lower risk of hypertension, like sauna affects all those things as well. Heat shock proteins are elevated after being in, 163 degree Fahrenheit sauna for 20 minutes. And these people are all in about 175 degree Fahrenheit sauna for at least 20 minutes, and their humidity's up. So it feels hotter, right? 20% humidity. It's hot. It feels hotter than 175. But there's another study that was done. I think it may have been out of either Poland, and it was 2022, I think. It was kind of, or somewhere between 2020 and 2022. So it's a little more recent. And they looked at a variety of different temperature and like temperature. The normal like 175 degree Fahrenheit all the way up to like above 200. And they looked at dementia and Alzheimer's disease risk. And it was very interesting because there was a lower risk of Alzheimer's disease dementia, but only in people that were using the sauna. Like it's 175 degrees. When they got up to the 200 degrees, that wasn't happening. And not only was it not happening, they had like a slight increased risk. So
it's probably a high degree of stress.
But who knows? There's reverse causation. There's lots of things, right? But I think the point is like I've been in 200 degree, a little bit higher degree saunas before, and like it's just too hot. Mm-hmm. I think it's too much.
So like you're cooking yourself. Yeah.
My head.
Yeah.
I'm like, this doesn't feel like the kind of like Like even when you do a really intense like HIIT workout, like you don't feel like that.
Yes, exactly.
Right. So I think there's an like heat can be dangerous. Heat can be dangerous. Right. So I don't know that going to this extreme 200-degree Fahrenheit is necessarily the best sauna protocol. It certainly has, like, we don't have tons and tons of data on 200-degree Fahrenheit and going in there for 20 minutes. Let's go 300. I'm right. I mean, so we have data like with people doing more reason. I mean, 175, when you're like 175, 180, it's hot, especially after 20 minutes. Like you're, you know, so long-winded answer to your question. I don't go to that extreme, especially when I'm pairing it after a workout. Heart rate elevates. I start to feel uncomfortable and I'm in a little bit longer than that. And then I'm out. Yeah. If I don't listen to my body, I will get a headache. Yeah. And the other thing I do is I take electrolyte supplement after that, because you do lose, you're losing a lot of sodium mostly, but like you'd also, and I don't eat like a high sodium diet. Like people eating a typical American diet, it's like they can lose sodium, no problem. Yeah. I don't. So I do, and that you do lose magnesium, like you sweat magnesium out. And so people that are athletic, people that are doing the sauna and are athletic, you know, you could go up to like needing more than like up to like 20% more than the RDA for your sex, like what your gender is, you know. So that's like another thing to consider, is like making sure you're getting hydrated and replenishing your electrolytes after sweating a lot from a sauna and a workout as well.
No, I think that's really good input, especially on the magnesium piece. I mean, that's like such a critical piece that's often overlooked, especially when people are taking an electrolyte supplement and they think that they're like checking that box. In reality, like a lot of times that isn't cutting it. You kind of need that additional.
Yeah, because half the country is already not getting enough magnesium. So almost 50% of everyone in the US is not getting enough magnesium. So athletic people on top of that are like even worse, right? Because, and then adding the sauna. So just taking a simple electrolyte supplement still not going to make you meet your requirement. You have to do more. Exactly. Right? So you have to like get your greens, you have to like maybe take an extra magnesium supplement. Like there's more that needs to be done to meet that requirement. I think it's good getting it from your greens. I mean, that's a great source of magnesium.
Checking a lot of different boxes there for sure.
Right.
So, where can everyone find you? And then remind us again where we can get your BDNF protocol as well.
People can find me. I have a YouTube channel called Found My Fitness. You can find me on Apple Podcasts, Spotify. I have a podcast, interviewed a lot of the people I talked about on it. It's Found My Fitness, again, all one word, Found My Fitness. And then also on social media, that's my handle on Twitter, Instagram, everything. And then if you want to get my free BDNF protocols guide, that can be found at bdnfprotocols.com.
Perfect. Well, Dr. Patrick, thank you so much. And as always, keep it locked in. See you soon.